Welcome to this edition of Inside the 1581. I'm Rich Rasmussen, and today we're going to continue our conversation with the candidates who are running in the runoff for the Republican primary. And we're delighted to have joining us today State Senator Mike Mazzei, who is running in the runoff for the Republican nomination. And we're going to spend the next 15 minutes talking with Mike about his vision for healthcare in Oklahoma and where you'd like to take our state. So, Mike, thanks for joining us.
Thanks for having me, Rich. Great to be here.
We appreciate it. And I know we're in this weird environment here. We're in a new building, and we've got the
nice
moving
digs.
signs. Well, it'll be nice when we get it
Where's
done.
everybody else?
Yeah, it's empty right now. Yeah, but it'll be full soon. But again, thanks for joining us. Folks, want to get to know Mike Mazzei, and our team members and caregivers probably want to get to know Mike. Tell us about Mike and about yourself and why you've decided to run for governor.
I'm a financial planner, Rich, and 30 years ago, we started from scratch a financial planning company called Trinity Strategic Wealth. And we're blessed. The Lord helped us grow that enterprise. And today we have $1.7 billion in client assets. And that afforded me the opportunity to be in the state Senate. 10 years I was the finance chairman. And then 2 years I was also Oklahoma Secretary of Finance. So I know a little bit about money and finance. And as we looked at some problems the state was dealing with, a tax code that was causing energy headquarters to leave to the no income tax state.
Right,
Texas,
we've had a couple of those of recent.
Chesapeake, now called Expand, an education system, 49th in the country, just completely unacceptable. I built a plan to make Oklahoma a no income tax state and abolish property taxes for seniors and veterans, still be able to pay all our bills for core services. I will hire a statewide literacy director to launch a massive statewide literacy program like the very successful Mississippi model, so our kids read at grade level. And I've also figured out how to have a workforce plan, particularly for healthcare, because there's 7,500 students on the waiting list of the 29 career techs, and many of the persons on those waiting lists want to be a nurse.
Well, that's a great way to kind of a segue to talk about, let's start with workforce. We can talk about some rural health issues and things like that. Tell us a little bit about, your plan for workforce. I know for hospitals, we the vast amounts. Well, let me just back up. What we spend principally in hospitals is on workforce. I mean, it is on the nurses, the physicians that we might employ, the other ancillary staff. We're kind of like our own little cities. So workforce is so important, particularly in those small rural communities where the hospital might be the largest employer, in some communities, the largest private employer. Yeah. So it's good to hear that you have real interest in workforce. So tell us what your plan looks like.
So my daughter, one of my 27-year-old triplets.
We talked about, because I've got twins.
I understand you have three 28-year-olds.
Yeah, exactly.
But one of my triplets is a nurse at St. Francis in Tulsa. And I've become, well aware of some of the labor challenges for healthcare. I'm also told by persons across the state that are part of our career tech system that two of the most sought-after programs for the 7,500 students on the waiting list, one is welders. That doesn't help hospitals so much.
Well, we build a lot of stuff. We
that's
repair
true.
Stuff.
Building a lot of
so,
stuff.
I mean, there's always opportunity there too.
One is welders, and the other most popular program is nursing.
Absolutely.
And so, unfortunately, the state legislature the last few years has not concentrated on our 29 career techs, which are really, really good. It's one advantage that we do have over other states. And the 7,500 students on the waiting list, I have a plan to get the required amount of resources and teachers. So we prioritize nursing programs, welding programs, those skills that our companies and our hospitals and our healthcare system need as a priority. And I've also got a recruitment plan for doctors that will follow what I built in 2014 when I was in the state Senate, the aerospace engineering tax credit recruitment program, which helped us keep hundreds and hundreds and hundreds of graduating engineers in the aerospace industry. We're going to launch a plan to make the first 5 years of a doctor's medical practice, if they'll start in Oklahoma, no state income taxes. That was a huge success for aerospace engineers, and it'll be a huge success for our healthcare community to inspire and motivate doctors to start their practices in Oklahoma. And after 5 years, we think starting their practices, getting married, having kids, a large percentage of them will probably stay in Oklahoma.
Well, I think you're absolutely right. I mean, we do find that where you have your residency, tends to make a determination of whether you stay or not. So I think you're onto something on that. And there's, we think of physicians or we think of nurses, but we have a lot of tech positions that really, roll right in.
And those programs are at our career tech facilities as well.
Absolutely. I do think one thing that maybe we can collaborate on is, on that strategy for recruitment, because I do think in this state, unlike a number of other states, a nurse can actually make enough of a living to buy her first home.
My daughter bought her first home.
Absolutely. And you can't say that in a lot of states,
No.
So I think there is a message that we can really sell, on Oklahoma.
And of course, we do have to go one layer down in terms of having our young men and women prepared for career tech or prepared for higher ed.
Sure.
And that is why I've built a statewide literacy program, because in Oklahoma, the statistics tell us that only 20% of our students going into high school can read at grade level. So that means, Rich, that there's 450,000 plus students in Oklahoma that aren't reading at grade level, and they're certainly not well prepared for post-high school education. So I will hire a statewide literacy director in my first week of the Mazzei administration to replicate the Mississippi model that took them from 50th to first in the country in reading outcomes. I've had a one-on-one meeting with their director. Her name is Amanda Malone. She's been in their program for the entire 12 years and the director the last 4 or 5 years. And we've talked at length about the 3 most important critical elements for their success. Reading curriculum that's all phonics, enough reading coaches and specialists to collaborate with teachers in all the school districts, and then what's called the 3rd grade reading gate. So there's some accountability to make sure the students are reading by 3rd grade, because after 3rd grade, they need to read to learn. When we do that, we'll empower thousands and thousands of more young men and women to be better prepared for career tech or college. And of course, we need as many of those entering the healthcare systems as possible.
I agree. Reading is a gateway to success, and particularly higher education, if that's the choice. Certainly also in career tech, the importance of reading. When we talk about workforce in our rural communities, it's a challenge. It is a challenge to be able to recruit physicians, nurse practitioners, and just maintaining the workforce that you need to keep that rural hospital viable. And one of the things that we've relied upon for that has been the supplemental payment program that Congress created, which now they're cutting, unfortunately. But Congress created the supplemental payment program in Medicaid that has really shored up the finances for rural hospitals. I mean, it really has. In fact, we're going to release a report in the next week that's going to look at before managed care and directed payment programs and after. And it's an incredible difference between our operating margins and our total margins. And so if you're elected governor, you're going to have to help us figure out how do we fix this? Because I don't think if Congress doesn't step back, we've got between the hospital cut of $6.7 billion and $1 billion from the docs, it's almost $8 billion taken out of our healthcare economy. And that's going to be painful to folks. So your thoughts on how we can collaborate on trying to address this issue, even if it's nothing more than, hey, an openness. I may not have the ideas, but let's work together and see if we can come up with one.
Part of my success in business, and particularly at the state capitol, was a listening ear, respectful dialogue, and ongoing collaboration with the stakeholders of whatever issue or projects we're dealing with. It took me 7 years, Rich, to fix the pension systems for police officers, teachers, firefighters, and everyone knew it was a problem, but it was hard to educate everybody on what the solutions and options were. But year after year, we worked on it in a collaborative fashion. And fortunately, today, our pension systems are sound. If we hadn't have done that, these retirees of ours would be receiving 30 to 50% less of their pension payments, or our income tax rate would be 10%.
Sure.
So we need that same type of collaboration with all stakeholders in the healthcare universe. Now, as a finance expert, I kind of know where to save some money. There was an audit done on Sooner Care back in 2019. The data was released in 2020. It found that because of some of the lax verification processes, there was $1.6 billion of questionable expenses every year. Well, unfortunately, the legislature never did anything about that. But over in the state of Tennessee, they got to work on some of those issues, and they applied for some federal waivers that basically say, if you clean up your system a little bit, because we certainly want to help the people that are in a safety net, and we certainly want to help our hospitals that are dealing with the Medicaid population, but we can't really afford to help people that are just abusing the system. Tennessee found $1 billion of savings that they were able to then use for the healthcare system in this changing, uncertain environment. So I know that's one thing we can all work on together. And then we'll sort of have to look at other strategies and other options to reinforce our healthcare system. I think we'll probably have some opportunities with our tribal partners, because I know to them, to your constituency, to all the people of Oklahoma, we want great access to healthcare. We want good access to a primary care physician, and we want great access to technology. So I very much look forward to working with your organization and your expertise as we try to find great solutions for the people of Oklahoma.
And I appreciate that, because it's a complicated field, right? And it's very difficult when you think about all of the different inputs to care, some of which the hospital really doesn't have control over. We don't have control over a lot of the costs. We have to pay competitive wages. We have pharmaceutical costs. We have supply costs. And if you have physician partners that are not employed, then you've got a different dynamic that's infused into the system. So it's doggone complicated oftentimes.
I've met with both hospital representatives, insurance company representatives, and independent physicians. Everyone's got, good ideas and thoughtful solutions. And if we can just have a finance guy like me get everybody kind of together on, okay, let's find ideas that we can collaborate on and work on solutions.
One other area that we often overlook, unfortunately, is the real challenges in mental health. We have a mental health agency that has struggled. We've got communities that are struggling with homelessness, and we have a workforce challenge as it relates to providing enough workers to help us in mental health. Just curious in terms of kind of your vision for how we might be able to address the mental health and substance abuse challenges in our states, homelessness in our state, because it still continues to be an undercurrent of a population that we don't give enough attention to.
Yeah, there's two primary factors making solutions and restoring lives challenging in the state of Oklahoma. One is drug addiction, of course, and one is mental health problems. On the mental health side, my wife was a teacher and then eventually became a licensed school counselor. And I can tell you the regulatory, administrative burden of becoming a licensed social worker, a licensed therapist in the state of Oklahoma is enormous. I won't belabor the details, but one of the issues is, for example, you get your education done, and then you have to do 2,000 hours of training, and who's going to go through all that? There's great people out there who are called by God and gifted by the Lord Almighty to be therapists and counselors, but we make it way too difficult to just get into the workforce. So we need to pay attention to that. And then on the drug rehabilitation side, we've messed up some stuff in the public safety arena by not focusing on programs that work. Here in Oklahoma City, there's a great program called Remerge. In Tulsa, Rich, we have a great program called Women in Recovery. Those actually receive taxpayer dollars through what's called a pay-for-success model. Now, these programs help women get through drug addiction and mental health issues and get their lives restored and get back into the workforce. And they have very low rates of recidivism. Well, instead of increasing their potential, they used to get a $2 million appropriation, each of them separately. Right. I know Women in Recovery this past year, their help from the state was reduced to $700,000, where all the while the Department of Mental Health and Substance Abuse, a $780 million organization, couldn't manage their finances and had to scream to the legislature, we need $60 million to make payroll. So we're taking money away from what works, and we're pouring money into what doesn't work. And that's got to be a shift in the opposite direction so we can address drug addiction, programs that work, get counselors into the field more quickly, and then we can kind of see some improvement for people struggling with mental health.
And it would seem, and it's a finance guy, that return on equity, return on investment is really important. And sometimes we don't always look at that, in government. So to your point, if this program in Tulsa is showing a real ROI, then why do we take money away?
Let's do more of that.
Right. If you invest more, the ROI gap grows larger and larger.
Mm-hmm.
We've talked a little bit about workforce, and I know one issue that we've had that's come up over and over again. We have conversations, particularly with our nursing community, which are our frontline caregivers, is the challenge of workforce violence against caregivers. And your daughter may have mentioned this, working as a nurse.
There was an awful incident a couple years ago.
And we did in Tulsa.
St. Francis.
Yes. So tell us what your thoughts are on that.
She was on the way to work.
Okay.
When the incident happened in the building where she works. And so obviously there was, just a tragic loss of life. And the St. Francis security system and the local Tulsa Police Department reacted quickly, and effectively. But there obviously needs to be conversations, collaboration between municipal police departments, security services for our healthcare facilities. So not just anybody can walk in the door.
Right.
We have to protect our healthcare workers, and we have to get the smart security people in Oklahoma that know how to protect these facilities and monitor entry points and exit points. So not just anybody can get in the door, and we certainly don't want anybody, getting in the door that's got bad intentions.
Sure. And it would seem, too, that what can help, and you would be in that role of having a bully pulpit, to talk about how important it is to have respect for our caregivers. And so as a dad of a nurse, I would assume that's something you hold close to your heart. Would
Give me a microphone and I'll do it.
Well, and,
Great.
and so that's I guess that's what I'm asking. Is that a place where you would feel comfortable, being that bully pulpit to be able to say, we need to respect these caregivers because they're giving selflessly to their patients, and is that something that for our listeners, 200,000 healthcare workers, is that what a Mike Mazzei administration would do?
I see these nurses, these nurse techs, other healthcare, technicians, just pouring, their hearts and their souls into their patients, and they need to feel safe. They need to feel respected. I think the community in Oklahoma at large has done a pretty good job of making sure our nurses and our healthcare workers, do feel appreciated, particularly after we all went through COVID together. And I know lots of us and lots of businesses like mine tried to love on our nurses and our healthcare professionals just as much as possible. But once those hard seasons are over, we need to keep doing it.
Sure.
Because
Absolutely.
they're still pouring out, their hearts and souls to bring solace and healing, to their patients. And anything I can do to be helpful in that arena, you just let me know and I'll be there.
We appreciate it. When we get ready to wrap up, because I said we try to keep it close to 15 minutes, is there anything you'd want to say in closing to our caregivers and our team members across Oklahoma?
Well, thank you, healthcare workers, physicians, doctors, technicians that work so hard in the hospitals and in the clinics, and you providers with at private provider clinics. I'm just amazed at, one, how smart you are and how much you care and how you chose to get into the healthcare universe to help people. And we appreciate you. I know from experience watching my daughter that it can be grueling, and we certainly want to be as helpful as possible. And we want to reinforce your efforts with more support, more healthcare workers, and definitely good, solid strategies to keep you safe.
Well, Mike Mazzei, thank you so much. And for our listeners in this episode of Inside the 1581, you've heard from Senator Mike Mazzei, who is a candidate for the Republican nomination for governor in the state of Oklahoma. Don't forget, Election Day is August 25th. That's Tuesday. And early voting starts tomorrow, Thursday. Senator
We
Mazzei,
certainly
thank
would
you.
appreciate your vote. And if you want to learn more about the Mazzei plan for growth and opportunity for our kids and grandkids, please check out MikeForOK.com.
Very good. Mike for OK. All right. Thank you, Senator Mazzei, for joining us.
Thanks for having me, Rich.
Very much. Thank you.